Welcome to MedInsight. My name is Dr. Ade Jatin. In this video, I will teach the steps in successfully passing a nasogastric tube. Don't forget to subscribe, share, like, and leave a comment. In the wiper approach, you wash your hands or apply alcohol-based hand wrap. Introduce yourself to the patient and establish rapport. Seek permission from the patient by explaining the procedure to them, telling them the reason for the procedure and the possible complications. Take consent from the patient, which can be verbal or written. You have to inform the patient about how uncomfortable the procedure can be. Expose the face of the patient. For privacy, screen the patient and get a chaperone if you have to expose the chest and abdomen. The patient has to be in the certain position to prevent aspiration. Get an apron to protect yourself. You may need an assistant to help you carry out the procedure. Note that this is not a sterile procedure, so you set your tray and get some important equipment. You need a nasogastric tube of an appropriate size. An examination glove, of course, you have to ask the patient if they have any allergies to latex. A lubricant gel, a stethoscope, gallipot with water, about a 10 ml syringe, an adhesive, a pH indicator, an immersive bowl or kidney dish, a suction in case of aspiration. So these are the steps to follow. First of all, you have to know the length of nasogastric tube to insert. And how do you know that? Measure from the tip of the nose of the patient to the earlobe and to the epigastric region or xiphisternum. You have to take note of the length of NG tube measured or mark it with a pen. The reason for doing this is to help you know if you are in the stomach. Also, it helps you know if the tube is in the exact position you left it after securing it. In this image, you can see the measurement is from the tip of the nose to the earlobe and to the xiphisternum. Don't forget to inspect the face for deformities and possible fractures. Inspect the nostrils for bleeding or masses so as to know which nostril to insert the tube. So you wear the examination gloves and apply the lubricant on the NG tube. Instruct the patient to sit or adjust the head of the bed at an angle of 45 degrees to 90 degrees if the patient is unconscious. The right nostril is preferred. Ask the patient for their preference. Instruct the patient to keep swallowing as you insert the tube and caution them about discomfort. Slowly insert the NG tube as the patient swallows or sips water. Time each push with a swallow till you reach the mark. You have to advance about 10 to 20 centimeters beyond the mark and you stop. You test if the NG tube is in the stomach. This can be done using many techniques which will be talked about later. You secure the NG tube with an adhesive and document the procedure. With the documentation, you have to state whether it was successful or not, whether you face resistance or difficulties, and the length of NG tube inserted. This is a picture of an NG tube successfully passed through the nostrils to the pharynx, esophagus, and the stomach. So these are some Viva questions for you. So how to confirm that the NG tube is in the stomach? First of all, you may see a spontaneous flow of gastric contents into the tube. You can insert the outer end of the NG tube into a gallipot with water below the level of the head of the patient. If you see bubbles in the water, it shows that the NG tube is most likely in the airway and not the stomach. The aspiration test. With this, you insert the syringe into the free end of the NG tube and aspirate the gastric content. You test the pH of the content. A pH less than or equal to 5.5 shows that the tube is in the stomach. The whoosh test. This test is done by auscultating the epigastric region of the patient as you draw air into the syringe and quickly push it into the NG tube. A whoosh sound is heard at the epigastric region, showing that the NG tube is in the stomach. Some teachings do not recommend this technique. Chest X-ray or an abdominal X-ray. This is regarded as the gold standard test to ascertain that the NG tube is in the stomach. As you can see in this picture, This is a successfully passed nasogastric tube because the tube follows a straight course down the midline of the chest, which points below the diaphragm. So here is the diaphragm. Here. The tube does not follow the path of the bronchus. Tube is not coiled anywhere in the chest. And also the tip of the tube is below the diaphragm. Here is the tip of the tube. And this is the gastric bubble, as you can see here. This is a picture of a nasogastric tube which is wrongly passed. So this NG tube passed is in the skull of the patient. This one is passed in the lung of the patient because it is coiled in the tracheobronchial tree and is directed towards the right lung. To stop passing the nasogastric tube when the patient shows signs of respiratory distress, when the patient cannot speak, when confirmatory tests are negative, when the tube emerges from the oral cavity of the patient, when the patient is actively bleeding from the nostrils, when there's significant resistance. Here are some indications for nasogastric intubation: for gastric decompression, enteral feeding, gastric lavage, in unconscious patients to prevent aspiration, for contrast studies. Take sample for laboratory investigations, to diagnose tracheoesophageal atresia, to administer medications. Here are some contraindications: base of skull fracture, nasal polyps, bleeding tendencies or coagulopathies, active bleeding, guanal atresia, patient refusal, recent upper GI surgeries, recent nasal surgeries, esophageal varices, esophageal stricture, alkaline ingestion, facial fracture. Some complications associated with nasogastric intubation: bleeding, aspiration, wrong passage or placement, pain, electrolyte loss, esophagitis, gastric perforation, necrosis of the pharynx, nasal trauma. Don't forget to subscribe, share, like, and leave a comment. Thank you.